大家好，我是有钱。现代人因为工作的关系，常常有时候工作中一直要坐着，然后就会产生了腰痛或屁股痛酸痛这种感觉。我们现在来看一看老奶奶怎么教我们处理腰跟我们的屁股做神经。来，正片开始。
Hi, Maria here. Today I'm going to be showing you some anatomy and physiology and techniques to release the deep hip rotators and the 3 glutes. And I would like to start with my client supine and show you a couple of tests, actually 3, to show you if it is sciatica, because I know all my clients that have low back pain right away, they say it's sciatica and they self-diagnose. So what I would like to make sure that you stay within your scope of practice and remember that this is not for diagnosis. We do not diagnose, but it is very helpful for us to know the difference, whether we can help our clients or we need to refer out. So while she's in the supine position, the first thing we want to do is do the tests. I have the client holding the sheet right here, and don't feel bad if you ask your client to hold the sheet so that she can keep control of the tightness so nothing is exposed. When we're working the deep hip rotators and the glutes, it's very important to ask your client to disrobe completely, because then you can really get in very specific work. So this is why she keeps control of the sheet so nothing is exposed at any time. This is the straight leg test. You lift the leg about 30 degrees and make sure you ask your client, look at their eyes, have eye contact with them, because their facial expressions can tell you if they're feeling any pain. They might not tell you right away, but you'll see them flinch. If I go higher and she flinches, then then she'll tell me, yes, she has pain. So you can go up 30 degrees all the way up to 90 degrees. And if she does have pain, the sciatic nerve is being stretched at this position. So if it is sciatica, she would feel pain. At this point, it's a positive test. So then you would want to do the Bragger's test, which you would dorsiflex the foot several times, 2 or 3 times, not several times, 2 or 3 times, to see if that also causes pain. So then at that point, if it's a yes, then you bring down the leg. You always assist. And that would tell you that that is more than likely coming from the lumbar area. There might be something going on there. The third test is for the piriformis syndrome. You bend the knee and you bring the leg over to the height of the opposite knee, bring it over this way, and push her leg over, stretching the piriformis muscle. And this will let you know if it's the piriformis muscle or the lumbar area that's causing sciatic nerve pain or other. I'll show you also when she's prone, I'll show you other things that it could be. So at this point, if it's hurting here and pulling here, more than likely then it's the piriformis. If it's the Bragger's test, the straight leg test, then it's probably the lumbar area. You assist the leg always, you don't let it flop. And at this point, you would have her let the sheet go. And also another thing, if your client does have low back pain, when they are in the supine position, you always want to put a bolster, because that takes the pressure off the low back. I use the Lacuna Botanical Deep Tissue Massage Cream. It has 200 milligrams of CBD oil. It is topical, not edible, and I use it specifically for people that have pain. And it smells very good. It's got very good natural ingredients. If you're interested in this product, I sell it on my website, and you can look at the link below. And you use a dime size. It comes already pre-measured, and it's very good. It glides very good. So I want to show you some techniques from this position while she is supine. I am warming up a little bit the TFL and the IT band. And from here, you can actually get the glutes. And what I'm doing is I'm cupping my fingers a little bit and going medially right on the lateral border of the sacrum and pulling out, because this way I am also massaging the piriformis, the gemellus, the obturators, all the way down. Okay, and this is her gluteus maximus that we drew yesterday on there. And what I'm gonna do is go with 8 figure 8s right here along the trochanter here, and show you real slowly, because all of the deep hip rotators insert right here on the trochanter like a hubcap. like that. There's 6 of them, so they're all right here and insert right here. So you want to make sure and get all of the insertions in the IT band, because the IT band is really tight on a lot of people. So from this angle, this is all you would want to do. Just some effleurage, petrissage. This is petrissage here. Some figure 8s with the knuckles. Get in there really close. You can feel her trochanter right there. And you can get the muscles from this angle. So now we're on the sideline position, and you always want to make sure that you're supporting the cervicals, that they're straight from C1 to C7 and from T1 to T12 and from L1 to L5, that it's a straight line. You put pillow between their knees, the bottom leg is straight and the top leg goes over bent. In this side view right here, you can see it really shows the glutes, and we drew them for you. We cut out part of the gluteus maximus because the gluteus maximus is still covering right here. But we cut it out a little bit so that you could see the gluteus medius. This is where you get a shot. When you go to the doctor and you get a shot, it's always in the gluteus medius. And the gluteus minimus, it's right here. Underneath also the gluteus medius. So you can kind of see the gluteus maximus, the origin at the sacrum, at the ilium, insertions at the greater trochanter, and also the gluteus medius at the iliac, the origin, insertion at the greater trochanter, and the gluteus minimus. You have 9 muscles on each side. Okay, you have your 3 glutes, and underneath the 3 glutes are the 6 deep rotators. So you have your gluteus maximus, medius, minimus. You have underneath that, you have the piriformis, gemellus superior, gemellus inferior, obturator externus, obturator internus, and the quadratus femoris. All of those are underneath here, and they're drawn on the other side. You will get to see those too. From the sideline position, you can do figure 8s. You can do skin rolling to warm up the muscle. You always want to make sure and tuck in right here at the hip, at the waist, so that nothing's exposed, and she holds the sheet with her arm. Okay, you can make sure that just expose this area. You can turn them on either side that's hurting, and you can do some petrissage, some effleurage, and this really exposes the muscles. Really, really good for you to be able to reach the insertions. Like right here at the trochanter, remember the trochanter where the femur, the acetabellum goes into the hip joint? It's all right here, and this you can really get the trochanter, all the insertions of the muscles and the trochanter. Remember the six muscles of the deep hip rotators are right here like a hubcap. So they all come from the glute, underneath the glutes, and insert right there around the trochanter. So you want to make sure and go like underneath, feel the bone, and get all those insertions. This really relieves a lot of tension and a lot of pressure. So this is a really good position for you to get each muscle underneath the superior and the inferior muscles, and also the superficial and the deep muscles. So remember that muscles come in layers. So the glutes are more superficial to the deep hip rotators. So right here you have your sacrum. It's a triangular shaped bone, okay? So all the muscles originate right here. Remember their origins are usually medial to the body, and the insertions are more distal. So from this place right here, you can really get all the origin of the gluteus medius, maximus. Right here, you can do 1-inch strips. You can do figure 8s. You really want to be able to address all the muscles right in this area right here. And this is a little bit deeper, and you address muscles that maybe you wouldn't be able to, that we weren't able to get from the supine position. And you can also, from this side, you can also work the IT band. You know, you go to the opposite side and work the IT band and just work all of this area right here where all of the muscles insert. I sometimes use over the sheet, and that's fine. I can massage over the sheet, and that's fine too.